So every year I review the world literature on nutrition, so I compile it, all the most kind of groundbreaking, interesting, practical advice into a kind of a quiz show format, which I enjoy giving every year here at the McDougall Advanced Study Weekends. One of the most fascinating studies to come out over the last 12 months was this study on the antioxidant content of over 3,000 different foods. The first thing they did is split things up into animal foods and plant foods, and animal foods had 64 times less antioxidants, the average animal food, than plant foods. So meat, fish, eggs, dairy, 64 times fewer antioxidants, and that reason alone is good enough to transition towards a more plant-based diet. Because if you think about, the leading killers here in the United States, not only can they be prevented and stopped in their tracks, but even reversed with a healthy plant-based diet.
Such as?
Heart disease. Heart disease, our #1 killer, both men and women, every single year for the last 94 years. Right? Back in 1990, Dr. Dean Ornish proved that you could prevent, stop, and reverse heart disease, yet since then millions of people have died, unnecessary deaths. We have the miracle cure, we've had it for decades, to our #1 killer, and yet how many people have heard about it? There's tremendous resistance in the medical establishment towards this kind of lifestyle medicine, and it's changing. But you'll remember, just recently, McDougall tried to get the, Senate Bill 380 passed through the California Senate, just to get a pittance, 7 hours of nutrition training for doctors over the next, 4 or 5 years, and the California Medical Association came out against it. Right? Mainstream medical associations came out against doctors even getting a few hours of nutrition. We know they're not getting in medical school. So out of the hundreds of hours of continuing medical education, at least could they get a few hours of nutrition? This was opposed by the medical establishment. What did we learn in medical school? We learned what the pharmaceutical industry wanted us to learn. We were taken out to drug lunches. That's where a lot of our educational materials came from. On average, doctors in the United States may get 23 hours of nutrition training out of thousands of hours of preclinical instruction. Usually it's just kind of the biochemistry of vitamins, not clinical nutrition, not nutrition on how to prevent, treat, and reverse disease. In fact, not just any disease, but the leading killers. If we really cared about helping people, right, these are the tools that we would give physicians to help people. Nathan Pritikin was reversing heart disease without drugs and surgery for decades before finally Ornish in 1990 published in The Lancet proving that you could open up arteries without drugs, without surgery, right, with lifestyle changes alone. Proved black and white, published in one of the most prestigious medical journals in the world. Only then, I think, did much of the medical world stand up and listen, but they haven't been listening closely enough. Yeah, there's a very interesting paper published 27 years ago in the Journal of the American Medical Association called The Tomato Effect. What they were describing is this, the resistance within the medical community against even highly efficacious therapies. And the reason they call it the tomato effect is because, in the 1500s, the tomato was a staple in European diet, but it was shunned actively for decades here in North America. Why? Because people thought they were poisonous. Despite all the evidence. In fact, it wasn't until 1820, I believe, someone got on the steps of the courthouse, ate a tomato, and survived. Did things actually change? And now it's $1 billion crop. That same tomato, which we thought was poisonous, for hundreds of years here in North America. And so they point out there's a number of things in medicine, the same thing. That there's this extreme resistance, this kind of clinging to orthodoxy within the medical establishment, even against things that we know work. And so I give the example of beriberi in the 1800s, when we polished brown rice to white rice before we enriched white rice with B vitamins. Millions of people in Asia died from something called beriberi, which is a vitamin B deficiency. It affects the heart muscle, so millions died of of basically heart attacks because of this B vitamin deficiency. Yet, once the cure was discovered, rice bran, the brown part of rice, or rice bran tea, there were still decades of death before the medical community finally came around. Same thing with scurvy. There's, 100 years. We knew lemon juice cured scurvy for 100 years before it was finally embraced by the medical community, because at the time it was thought to be a disease was, imbalance of the humor. So what possible role could diet play? Right? I mean, so these showed the examples of the so-called tomato effect. And so I tried to kind of modernize that concept into the field of nutrition, saying, look, we have an epidemic of heart disease in this country. Millions of Americans at risk. Another disease caused by diet. Another disease for which we have a cure. How long must we wait?